It's actually a new form of an old virus. It's conformed over from an equine flu. In 2004, they started seeing it in Florida, major racing tracks with greyhounds, and then now it's starting to spread throughout the rest of our population. And started seeing it in Dallas a couple of years ago. This year, I know we had major outbreaks in Victoria and San Antonio. I don't really think we're going to start seeing it here in West Texas pretty soon. And I know there's some people in Odessa that think they've seen a couple of cases, and I've got a couple of suspects. And a little harder to diagnose than most things. Kind of a treatment response. There are a few things to send off test-wise, but they're complicated and not necessarily that accurate to start with. You have to hit within a certain time period. If you miss that time period, they don't bring them in for a couple of days, then it won't test positive. So.
Let's talk about some of the symptoms. Say if you have a dog out there that is sick, what are some of the symptoms? Is it anything like human?
It can be. It can get to the lethargy, kind of vomiting, but most of them, it's just about 80% of them are just going to cough, and it'll be a persistent cough for up to 2 to 3 weeks. And they won't respond to antibiotics. They just hang out, cough. The rest of them will end up needing some IV antibiotics, IV fluids to kind of keep hydrated. And most of the antibiotics, it's not treating the flu because it's a virus. It's going to be treating the secondary bacterial infections that set up because our body's weak. But 80% of them will recover just fine. But they're shedding that virus for 2 to 3 weeks. And they said they'll start shedding it within 2 days of contact, which by that point you don't even know the dog's got the disease, but it's already shedding it. 20% of dogs won't even show symptoms, but they'll be shedding the virus. So it's one of those that, especially those going to groomers, boarding facilities, should really consider, because it's going to be an important vaccine for our future.
Right, and you store that and you stock that here at Sierra Animal Hospital.
But like I said, kind of like kennel cough, anything that goes boarding or grooming should really consider doing it. And I'm kind of hoping a lot of your groomers will add it to their demanded shots before they come in. But a lot of them don't require anything, so that's the ones we'll see major spreads through.
Okay, and are you concerned? Are you worried that we'll start to see more of that here in Big Spring?
I think we will. It seems to be moving across Texas progressively. You know, it started in the east, major around the racetracks, the greyhound tracks, and major population areas. But I think especially this time of year when we have a lot of family traveling, a lot of people traveling, that their dogs will be spreading it, and we will start seeing more and more of it in West Texas. Plus, a lot of people are buying puppies that came from more populated areas, and puppy mills, pet stores where they've got an increased chance of spreading it. So I think we will see more of it this time of year.
Okay. Is it a deadly virus if not treated?
Only about 5% of the time, maybe a little higher in some instances, but 5% of the time has a mortality rate. And the rest of them, they should be kind of like people, just kind of get sick. If you treat them symptomatically, get them on some antibiotics, they should recover just fine.
Okay.
Flu, I'd say the flu shot. There's a couple of different versions out there. All of them have been proven very efficacious. That does take 2 shots the first year, and then that's just a yearly shot, so it could be just done with annual vaccinations. And I definitely think it's worthwhile. It's a little different. Not used to having flu. Everything seems to have a flu these days, but
sure.
But it's just a new strain that we should be able to control pretty easily.
Mm-hmm. And let's talk about side effects with that. I know people have flu symptoms after they get the flu shot. What about animals?
The most common thing would just be laying around kind of lethargic for a day. Most of them shouldn't show any signs of the flu, but they could lay around, kind of feel bad for the day, not eat, kind of. Even a few of them may just get a little stomach ache, but usually the next day they should be fine.
Okay, all right.
And the canine influenza can stay on your clothes for up to 24 hours, hands for 12, and then anything in the environment, pens, cages, up to 48 hours. So if we do have a suspect, if people really do need to clean the cage, bleach products, 1 part bleach, 10 parts water, and clean it up thoroughly, or else they'll keep spreading it to every dog for the next period of time. And it will stay for a little while. So definitely hand sanitation, just like we do for us. Clean your hands, use hand sanitizer, and if you have a suspect, try to isolate them out.
Could dog viruses be contracted to human viruses?
Not at this point. There's been no proven cases in the U.S. or that I can find in the world where the canine flu has infected a person, unlike the swine flu. So I think we're going to be safe from this one.
Okay.
It'll do.